The following medical conditions should be considered emergent with immediate referral and medical attention. This often necessitates a 911 call and transport. Each clinic should have guidelines for a rapid response system with roles spelled out for first, second, and third responders to the situation. All personnel involved in patient care should be certified in health provider CPR, and routine drills should be performed given that situations should arise and will arise. Shock is a life-threatening condition due to a lack of blood flow. This means that cells and organs don't get oxygen and nutrients to function properly. This requires immediate attention and can get worse rapidly. As many as 1 in 5 who suffer shock will die from it. Cardiogenic shock, as with heart failure, severe trauma with internal and external bleeding, toxic shock from infection, anaphylactic shock due to an allergic reaction, and neurogenic shock due to injury to the nervous system are several examples. Symptoms to look for include systolic blood pressures of less than 90 millimeters mercury, rapid heart rate of greater than 110 beats per minute, diaphoresis and pallor, and postural hypotension. Unstable angina is a type of angina pectoris that is irregular. It's also classified as a type of acute coronary syndrome. It's caused by disruption of an atherosclerotic plaque with partial thrombosis and possibly embolism or vasospasm. It's characterized by at least one of the following. It occurs at rest or minimal exertion and usually lasts less than 20 minutes. It's described as being severe and as flank pain. It occurs with a crescendo pattern, which means it's more severe, prolonged, and increased in frequency than previously. Dissecting abdominal aneurysms, or aortic dissection, occurs when there's a tear in the inner wall of the aorta, causing blood to flow between the layers of the wall of the aorta, forcing the layers apart. In most cases, this is associated with severe, characteristic chest or abdominal pain, described as a tearing in character, and often with other symptoms that result from decreased blood supply to other organs. Aortic dissection is a medical emergency and can quickly lead to death, even with optimal treatment, as a result of decreased blood supply to other organs. Acute shortness of breath, and there are many different conditions that can lead to the feelings of dyspnea or shortness of breath. The most common are cardiovascular causes, such as acute myocardial infarction and congestive heart failure, while common pulmonary causes include chronic obstructive pulmonary disease, asthma, pneumothorax, and pneumonia. Stridor, which is an inspiratory noise or obstruction. It's an abnormal, high-pitched musical breathing sound caused by a blockage in the throat or the voice box, the larynx. It's usually heard when taking in a deep breath. Neurologic concerns that may necessitate emergency treatment include convulsions, which occur when a person's body shakes rapidly and uncontrollably, seizures, sometimes epileptic seizures, which are a brief episode of abnormal excessive synchronous neuronal activity in the brain, those that develop extension rigidity, those that have sudden changes or dramatic changes in blood pressure with neurochanges, those that black out or have lack of consciousness, and those with sudden unexplained change in mental status. In terms of psychological profiles, one must be acutely aware of the individual who presents with impending suicide and who describes a plan to carry that out. Genitourinary disorders are illnesses that occur when the urinary organs and genital organs are not functioning properly. Of significant concern are those individuals who present with ectopic pregnancy signs. Most often, ectopic pregnancy happens within the first few weeks of pregnancy. Occasionally, a woman may not even know she's pregnant yet, so it can be a shock. Doctors usually discover it by the 8th week of pregnancy. Symptoms of ectopic pregnancy include light or moderate vaginal bleeding, nausea and vomiting with pain, lower abdominal pain, sharp abdominal cramps, pain on one side of the body, dizziness or weakness, pain in the shoulder, neck, or rectum, and if the fallopian tube ruptures, the pain and bleeding could be severe enough to cause fainting. Gastrointestinal diseases refer to diseases involving the gastrointestinal tract, namely the esophagus, stomach, small intestine, large intestine, and rectum, and the accessory organs of digestion, liver, gallbladder, and pancreas. Of most concern are those patients who present vomiting blood. A 911 call can be necessary for those injuries or accidents that occur in the clinic or falls where the patient has significant trauma or injury. Medical attention that is urgent but not a 911 call, where the doctor needs to be notified immediately, or of those individuals whose general health looks awful but not distressed. They may have fever, sweats, and chills. Their skin, you may notice some masses or lumps or red streaks with color or temperature changes. They may have incurred a recent head injury, which may be unreported previously. They may have dizziness, unsteadiness, nystagmus, severe unexplained or unusual headaches or red eye. The neck may demonstrate swollen lymph glands or nodes, acute lack of motion or from a recent injury. Pulmonary system, they may have shortness of breath, wheezing, a pleural rub, chest sounds or coughing blood. Cardiovascular, the individual may have exercise-induced angina, chest tightness, absent distant pulses, DVTs or blood pressure changes suddenly outside the normal range, and chest pain with sweating. They may have a gastrointestinal difficulty with swallowing, blood in stool or urine, abdominal rebound tenderness, vomiting, acute strangulated hernia. Genitourinary, they may have discharge, sudden onset of pain with intercourse, acute urinary retention or incontinence or hematuria. Peripheral nervous system, they may have recent or sudden onset of numbness, paresthesia, weakness, tremors, recent or sudden onset of radiating pain. Endocrine system, recent or sudden onset of excessive thirst, hunger, sweating, ketoacidosis, hypoglycemia. Psychiatric may have some recent or sudden onset or change in nervousness, tension. They may report abuse or depression. Musculoskeletal, they may have red hot joints, missed fracture, exquisite pain over a bone or spinous process. They may not have any injury, but they may have cardinal or serious signs, especially with neck motion. This can include drop attacks, nystagmus, upper motor neuron signs and symptoms, ataxia, lip paresthesia, dizziness, dysarthria, diplopia, or dysphagia. It will be your responsibility to determine which category the medical condition in front of you needs attention, be it 911, urgent, or prompt. Your ability to effectively communicate the patient's condition or situation by providing accurate, objective data to the appropriate medical personnel will determine how and whether they get the care they need. You may need to be the patient's advocate if you don't feel the attention that's needed is being provided.